Good afternoon. So, when you think of starting your practice, so this is one thing which you have to plan. That is how to fix your surgical tariff. So, I feel there are two ways. One is the actual way, costing, doing a costing study and analyzing that, and then based on that, making your profit package. And the other more simpler method probably comparing with other similar hospital packages. So when you are talking about the comparing, so if you have, when you start a practice in a place, so it may be a rural place or it may be an urban, it may be a city. So if it is a city, then there may be other hospitals in in that city, which may be something having the same facilities that your hospital has, having the same ambience. Whether you are trying to reach out to the patients of the lower strata or the higher super specialty cadre. So based on that, you will be selecting those hospitals and comparing, getting the package rates of those hospitals, and then maybe based on that you can decide your. Or if there are no other similar hospitals, maybe there may be other hospitals in a similar type of city in some other district. So, and nowadays, because of this NABH, where transparency is mandatory or it is necessary, it's very easy to get all these package rates now. Previously, it used to be very difficult. You had to have a lot of espionage work and all. But now it is very simple because all hospitals display the packages very well. So, when we compare on that, and then based on that, plus or minus, you can set your package rate. So, that is a very simple and practical method because but the better method, the more scientific method, I would say, would be doing a costing study. But here you calculate the actual cost of your surgery based on the target that you may reach. If you have started a hospital and you say you target, I will do 50 surgeries in a month. So based or in a year, I will do 500 surgeries. So based on that target and the actual cost of your own, of each procedure, of each surgery, so and the amount of profit that you would expect from one surgery, based on that you can make your package. So when you do a costing exercise, there are like two types of costs involved. We all know that. One is the fixed cost. Fixed cost is something which you have to pay these expenses, whether you operate on one patient or you operate on 100. The rent that you pay for the building, like most of us start in leased property. And labor is a very important cost because that again, your salaries and labor, that cost will always be there, even if you operate few patients or you operate more. Electricity, your equipment, depreciation of the equipments and other support services that you have. Whereas the variable cost, of course, will depend based on the number of surgeries you do. That is the IOLs and medicines and consumables that you use. So that is going to vary depending on the number of surgeries that you do. So there is one small table which will show you how your cost, your profit will change depending on the number of surgeries that you do. For example, if you do have a cataract surgical volume of say 500 and the fixed cost per surgery comes to say 8,000 and variable cost 2,000, then the cost per cataract would be 10,000. And on top of that, if you say you want a profit of 30 or 40%, your cost, you can package it as 14,000. So your profit is 4,000. But if your volume say increases, say the next year increases to 1,000. So with this small increase in volume, you may not have to increase the space or you may not have to increase on your number of staff. You can still manage to with the same number of staff and the same place and same equipments. But you find here that your fixed cost per cataract comes down. It comes to half. If you increase the surgical volume by double, it comes to half, 4,000. So your proportionately, your total cost per cataract comes to 6,000. And if your package rate is still 14, your profit would be almost 8,000. Similarly, as volumes increase to a particular level, after a particular level, of course, you will have to increase your space, you will have to increase your number of staff. But what is important is the optimal use of manpower as well as space. And then your profitability will definitely increase. And doing a costing exercise actually is a very cumbersome process and it's not possible for most of the time we will have to take the help of a chartered accountant because here you have to take into account each and everything, like right from a small thing like a wire speculum, your towel clamp or your needles, your tooth forceps, phaco choppers, everything. And the life you have to decide of those equipment. Normally, if we say it's a life is 2 years, and based on that, we have found that in a phaco, for one case of phaco, the cost for small instruments, micro instruments, comes to 144 rupees. Consumables, similarly, you have to take the cost of all syringes and blades and caps, wrinkle lactates and phaco tips, right up to phaco tips, phaco sleeves, your sterilization things, consumables like ETO indicators, Y indicators. So everything this is for our hospital, for the amount of surgeries that we do. We have found that the cost comes of all these consumables comes to some 1,500 rupees per phaco surgery. Labor is the one which contributes maximum to your cost because ours is a service industry. So we need to have a lot of staff to give a good experience to our patients, to see that there is not much of waiting time, to see that each and every patient goes happy. So we need to really invest on the labor. And right from the surgeon, the anesthesiologist, OT staff, daycare staff, optometrists who do your biometry, all those things have to be considered, your counselors, housekeeping staff. Even your insurance staff, even the salary of insurance staff will contribute to your surgery. So this will come to around 3,000. In our case, it comes to around 3,300. So which is contributes maximum to the cost of cataract surgery. So when you compute all these things together, that is your consumable surgical instruments, your calibration, your labor, manpower, equipments, your furniture, indirect depreciations. So this was all done by a chartered accountant. So in everything, the total cost of the surgery comes to around 10,700 in our case. This is for our case. For each hospital, it will be different. For the number of surgeries that we do. So it comes to around 10,700. And if we package, this is for a Indian hydrophobic lens, phaco foldable. And if we have a package rate of say 15,500, then our profit is 30. When we decide that we will have a profit of 30%, then it will come to around approximately 5,000 or 4,700 is the profit. That is, this profit is before tax because you have to pay tax on this at the end of the year. So this, whether it is 30, 25 or 40, that you have to again decide based on the charges of the other competitor hospitals, because you cannot decide just because I do 5 surgeries, I will take 60%. That is not going to work because your patients are going to go to some other hospital. But generally in eye hospital, the revenue comes from surgeries. So it is important that while your OP and all those things may not be very high, so you should have a decent profit keeping in mind your comparative charges of the other hospitals. So this is the way of making the surgical package, and then you can increase your profit while maintaining the same surgical package by cost containment strategies. I think every institute should have this in their DNA. It should be in the culture of the organization to reduce unnecessary costs, right from small things like switching on off the fan when you go out of the room. Not only you do it, you have to be as a role model, but you see that each and every staff in the hospital should be having that culture. That is not only for the hospital, that is also for the nation actually, where you are trying to conserve energy. So small things like that. And then manpower planning is very important. So if you are depending on the patient load, say in your daycare, if you are going to see only 10 patients and if you have 5 people looking after there, that is actually waste. So based on your workload, you should have the manpower. So that is very important because the labor, I said, contributes maximum to the cost. Then care of equipments. A life, say you buy a automated perimeter, its life if you look after it properly with good AMC and good care, you can use it for almost 8 to 10 years. In our hospital, we are using that much. Similarly, good systems and procedures, all this will help you in the optimal use of resources so that your cost will come down marginally, so that proportionately your profit will go up, so that you can afford to have lower surgical packages. So this is in short what I wanted to say about how to plan for your surgical package. Thank you.
Thank you, Anup. Good talk. In my private practice, I used to tell like the way to sell the package is to tell the patient whichever financially you can afford, please take it. That it really helps, and once we tell that, they feel that we are on their side. Then slowly, actually, you can, this lens is better, so something you can tell. But always when we tell that, depending on your financial thing you can do, they feel very much comfortable in there rather than telling this is the best. If you don't do this, this is not good. Anyway, that's one thing. Anyway, excellent talk, Anup.